Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul uqdatam min lisani yafqahu qawli. Again, I am Dr. Mudassir Shabazz, Associate Professor, Sahara Medical College, Narowal, in Anatomy, Associate Professor, and we were discussing about the gross anatomy of the lower limb because we are finished with the upper limb. Before starting this online lecture, I was thinking one thing, that usually we used to, every one of you people has the mobiles with you, highly sophisticated mobiles, a great series of highly costly mobiles, having a lot of applications in the mobiles, and mostly you are using YouTube's, TikTok, and other things, games. You are playing games. So what I was thinking, well, why not to play with the anatomy? Why can't you play with the anatomy? You can play with the anatomy. So how can you play? This is a question. How can you play? The answer is very simple. If you want to play with the anatomy, then it can be done in this way. Open up any one of the diagram in your book, or open up the atlas with you. Just like, see, I am opening, as in the previous lecture, opening this diagram in front of me. So how can I play with it? I took a paper, plain paper. By seeing this diagram, I start writing what I am understanding from this diagram. First I will draw the diagram on my paper, trying to how much my artistic is there, but I will try to draw it. My drawing is better or not, that's not okay, fine. Then after labeling, then I start defining the things which I am seeing in it. So if I see, say, inguinal ligament, I start writing that inguinal ligament is a fibrous thing attaching from the anterior superior iliac spine to the pubic tubercle. And what is inguinal ligament? Now again, so I write down below this that it's a enrolling of the aponeurosis of the external oblique muscle, which is a muscle of the anterior wall of the abdomen. Now again I see what is this. I write down that this is femoral sheath covering the artery, vein, and canal. Now I define their relations. So artery is lateral, medial to is the vein, medial is the canal. And the canal is bounded medially by the lacunar ligament, sharp margin of the lacunar ligament. And now I try to define that how this femoral sheath is forming anteriorly fascia transversalis, posteriorly psoas fascia. I write down these things myself. Then I confirm it from the book. If I am right, I am defining it very efficiently, so I have won the game. Now I know about the anatomy. I can write down myself what am I seeing on this diagram. So it's playing with the anatomy, making the MCQs here from this diagram. I can do a lot of things. Why the femoral nerve is outside the femoral sheath. So I can define it using my mind. So I can play. So in this way, we can play with the anatomy. We can enjoy the anatomy. If we are right, we will feel. If you do this practice, you will feel that you will feel a certain happiness, a great pleasure when you see that, oh, I know the things. I can define the anatomy myself. I have seen this. Okay. Now, I don't know whether you will do this practice or not, but I hope so. If you want to enjoy the anatomy, practice it. Practice it on your own body, practice it on the atlas or the diagrams in the book, and then confirm them from the written material given in the books. Okay, now previously we have discussed about the femoral triangle, femoral sheath. Now today we are going to discuss about the adductor canal. So one thing is that adductor, one word is adductor, other is the canal. It means canal means a passageway through which a small tunnel, that should be a small tunnel through which certain structures would be passing. And this canal is present in the adductor, some of the adductor muscles. So I recall myself that there are actually 3 adductor muscles: adductor longus, adductor brevis, and adductor magnus. So which adductor muscle? Why it is called as adductor canal? So then I see it, an intermuscular cleft situated on the medial aspect of the thigh. So medial aspect means there the adductor muscles are on the medial side. So it's a cleft in the intermuscular compartment. Medial third of the thigh beneath the sartorius. It means it's not a straight one, because we have seen the sartorius muscle, which is oblique one. It's not a straight one, extending from the anterior superior iliac spine to the medial side of the medial condyle of the tibia. So it's not a straight canal, it's oblique one. That's what I understood. And this is in the middle third of the thigh. I know that the above was the femoral triangle. It means that this should be, adductor canal should be below the femoral triangle. Okay. Now, other name is called as Hunter's canal. Why? Because there was a doctor, John Hunter, who first exposed the femoral artery in this adductor canal, and because he has to operate on the popliteal aneurysm, so it has to be ligated above the femoral artery, and he ligated the femoral artery in the adductor canal. Okay, and here the femoral artery and vein passes into the femoral popliteal fossa from the adductor canal by passing through a hiatus. Hiatus means a big opening. A hole is small. Hiatus means a big opening in the adductor magnus. So now I come to know that this adductor word is for the adductor magnus, not the adductor longus, not the brevis, magnus. Now I go to the next slide and see where is it. So here, see, I see finishes the what? Finishes the femoral triangle. And this is adductor magnus, and here is lying the sartorius. So this canal should be below the, hidden by the sartorius muscle. Okay. And here should be the adductor magnus muscle. Here is the adductor hiatus, and that is hole in the adductor magnus. And by passing through this, the vessels, femoral artery and vein, they go into the posterior side in the popliteal fossa. Okay. Now, first of all, I would like by you people to see this diagram and try to draw it. Try to draw it. Obviously, this is the femur, shaft of the femur, and if this muscle is the adductor magnus and this is the vastus medialis, so means this is the medial side of thigh and this will be the lateral side. So if this is the medial side, so this should be the right leg, right thigh. Okay, so what I seeing here is it's a somewhat triangular. Okay, and if this is the posterior one, means it is the adductor magnus over which the canal is present. And anteromedial, it is bounded by the vastus medialis, here with the fascia covering the vastus medialis. And if I see laterally, I can say laterally or anterolaterally, say laterally. Here is the fascia, which is vasoadductor membrane, means a membrane extending, a fascia extending from the vastus medialis to the adductor magnus. Outside this membrane is the sartorius muscle. So what I do understand from this diagram is that actually the boundary is formed by this membrane, vasoadductor membrane. The sartorius muscle is only covering this canal. It's not forming the boundary, it's covering the canal. So I have come to know it's the boundaries. Now what I am seeing inside this, So if I say this is medial side, this is lateral side, so medially is present the femoral vein, laterally is the femoral artery. Anteriorly is the saphenous nerve. This saphenous nerve must be a branch of femoral nerve coming into the adductor canal. And I now recall it that this nerve is actually a cutaneous nerve which will supply the leg up to the foot. If I see medially, anteromedial to the vein, so here you are seeing that I am playing with this diagram. So anteromedial to it is a nerve to vastus medialis. This is also a branch of femoral nerve. Okay, so if I get outside this, here are some other cutaneous nerves lying under the sartorius. Sartorius itself is supplied by the femoral nerve. Anything missing? I don't know. So, but what I see, if I draw this, I can now define these boundaries and contents of the adductor canal. Now I am going to confirm it. Here again I am seeing the diagram which is having adductor canal. If I see this is, here is the anteromedially vastus medialis, and laterally or anterolaterally is the membrane, and this is the sartorius, and on the posteriorly here is the adductor magnus muscle, adductor magnus, along with part of the adductor longus. Okay, and in the content I am seeing here, so this thigh should be of the left side because this is medial, this is lateral. So here is the medially is the, here it is shown the artery, vein, is, and then is the nerve, saphenous nerve. Okay. Now I see the boundaries. Anteromedially sartorius, posteriorly adductor longus and magnus, laterally vastus medialis. So what you have got here, what blunder that I have done, now I will not forget in my whole life by recalling this diagram that actually the vastus medialis is not medial, anterolateral. Anteromedial is the sartorius. Now I am corrected that anterolateral is the vastus medialis, anteromedial is the sartorius. You may have noted this point or not, but here the point is present. So what we see here also in this diagram, this vastus medialis is actually forming the boundary which is anterolateral, not the medial one. So medial one is the sartorius. Okay, so I have solved the quiz now. Now I have confirmed and I have found my that I was wrong. Where I was wrong, now I have corrected myself. Now I will not forget it. That's anteromedial sartorius and laterally vastus medialis and posteriorly adductor longus and magnus. Okay, so and now I will confirm the content. The femoral artery I have seen in it, femoral vein I have seen it, cephal nerve I have seen it, nerve to vastus medialis I have seen it, terminal part of obturator nerve. So that's not mentioned here. So I will try to find out where is the obturator nerve branch. If not, I will add that branch into this diagram. Okay. So why I'm so curious to know about the adductor canal? One is that what we have seen in the first slide, that it is known as hunter canal. Why? Because it is the hunter who first exposed it to ligate what? Femoral artery. So you can expose femoral artery here in the adductor canal, and a nerve is lying in it, that is the saphenous nerve, which is a cutaneous nerve. So it can be blocked. So you can put a adductor canal block. So it's a local anesthesia which is given in the adductor canal to block which nerve? Saphenous nerve in isolation or together with the vastus medialis. It will provide what? Sensory anesthesia for the procedure, what? Distal thigh, for the involving the distal thigh and femur, knee or lower leg on the medial side. So if you have to operate on this, you can block the saphenous nerve and nerve to vastus medialis by putting adductor canal block. The sartorius and the femoral artery, they are used for the anatomical landmarks. Here we are seeing how the adductor canal block is put. This is an ultrasound probe. Ultrasound probe is put over here and flow of the artery is seen on that screen, and and a catheter is put in here and in this through this we can avoid the puncture of vein or artery, and we can put the local anesthesia here without damaging the femoral artery or vein, and this is by the help of ultrasound, and this is called as ultrasound guided adductor canal block. Another thing which is adductor canal compression syndrome means is here is the entrap, because it's surrounded by a fascial thing, so neurovascular bundle can be trapped within the adductor canal. A rare condition, but usually caused by hypertrophy adjacent such as vastus medialis. Young males is more common. Claudication symptoms due to femoral artery occlusion. Claudication means when you are walking, after covering a certain distance, you tend to develop pain in your calf muscles, and that stop you from walking. That's called as claudication symptoms. And the distance which you can cover without having pain, after that point which you develop the pain in the calf muscle, that distance is called as claudication distance. So it is usually due to the blockage of the femoral artery or the neurological symptoms due to entrapment of the saphenous nerve. So you will have paresthesia or anesthesia on the medial side of the leg if the saphenous nerve is blocked. How it can be confirmed? The adductor canal compression syndrome is by doing the angiography. So this is the normal one, that the blood is flowing normally in both the vessels. But here you can see the blood is somewhat flowing in the right side, but on the left side there is much less dye is going onward. Here is some of the dye is going. So he will be most probably having claudication on the left side. So A is the normal one and B is the where is the blockage of the femoral artery. Where? In the adductor canal. Okay, so what we have learned today, that adductor canal is a canal on the medial side under cover of sartorius. It's also called as Hunter canal. Why? Because John Hunter first exposes the femoral artery in this area, and this starts below the apex of femoral triangle, and its extent is below is the adductor hiatus, through which passes into the popliteal fossa, and the boundaries are anteromedially sartorius, posteriorly adductor longus and magnus. Laterally is the medialis, vastus medialis. Here we see laterally is the vastus medialis, and anteromedially is the sartorius, posterior the adductor. And contents, here we are seeing the nerves and femoral artery, vein, then is the nerve, saphenous nerve, then is the obturator nerve to vastus medialis. Here, because of hypertrophy of this vastus medialis, we can imagine that the entrapment syndrome can develop here. Okay, and if we ultrasound it guided, needle is put here, avoiding the damage of these structures, we can put the adductor canal block here. So here again they confirm the boundaries and contents and the clinical reference, and inshallah further on we will learn about the more things about the anatomy. Again, today's advice for you people is that if you try to play with anatomy, I don't want that you are doing MPhil or you are going to be a professor of anatomy, but it's a game. Try to play it with yourself. Inshallah, you will see that your anatomy will become stronger and stronger, and it will create a lot of confidence within yourself. You will be able to describe the things yourself by seeing only the diagrams. And the last advice which I have given you before, try to find out these kind of diagrams from where you are find, from the books, from the net, from other things. Try to collect them, draw them, so they will be helpful for you in the examination point of view. Bundle of thanks and God bless you. Allah Hafiz.